Soaring high and making difference, where we talk anything about nursing. So let your voice be heard. Right here, Moments with Professor X.
Good morning, everybody. It's me again, Sander. How are you guys? Good morning, Philippines. Good morning, Las Vegas. I know it's 1:30 a.m. in the Philippines. How are you guys? Today is actually Saturday. It's August 23, 2025. Few days more to go, and we can finally say it's over August. And we're ready to allow September to kick in. And you know what? If it's September in the Philippines, that is the month when we start celebrating Yuletide season. So the stretch of Christmas celebration will not just run for a few weeks. It's a 4-month celebration, sometimes 4 to 5 months. Anyway, good morning, everybody. Hello to Lester Visaya. Thanks for watching. How are you? Actually, bago ako umalis, I made a promise that I'll go live like second week or no, first week ba yun? First or second week of August. But sorry, I wasn't able to keep my promise. Now, for those who are following me for quite a while, you know, I just came back from London, UK. I had a great time, guys. I did not post a lot of pictures, but most likely next week I will. I'll just sort it out and then post nice pictures just to show where I went. Yeah, so if you have time to visit London, you go to Salisbury. I recommend the place. It's just a train away from London Central. And if you're a nurse, it pays really nice. And it's a nice feeling to visit the grave of, I'm not saying that you're happy that you passed away. What I'm saying was it's a nice I think accomplishment, shall I say, to pay respect and visit the grave of the Florence Nightingale. If you're a nurse, you know her contribution. She is the model of the modern nursing, right? Anyway, give me a few seconds. I have to make sure that I'm also streaming on other platforms. Give me like a few seconds. Okay, I don't know. Hello to Clarence Valdez Carrion. Thanks for watching. Anyway, so I believe na nasa title naman ng clip na to that I will talk about DVT or deep vein thrombosis. Now, I find this very timely because I just came from a vacation, and you know, the deep vein thrombosis is very common if you're immobile, if you don't move, if you don't walk. So there is always a risk of clot formation. So sa mga hindi po medical oriented or may mga medical background, when I say deep vein thrombosis, ibig sabihin po nito may namumuo pong clot, barado po yung ugat. Ayan. Okay? Sa ating vein o sa artery. Okay? So malalaman po natin ano yung mga causes nito. And by the way, just a disclaimer, Whatever will be the discussion today or on this clip or kung kailan ako makapag-Facebook Live, this will not replace the medical treatments or the medical suggestions or recommendations of your doctors or your what do you call this, a PCP. Okay, so your doctors. So this discussion is intended to help nurses as they conquer their qualifying examination. So when I say qualifying examination, this will not only limit those who are taking the NCLEX RN, okay, or the NCLEX PN, but also those who are taking their licensure examination back in the Philippines or somewhere else. So I just hope this discussion or the succeeding discussions we will have in the future will help you prepare your qualifying exam. Okay? By the way, again, it's me, Sander. Oh, hello to Michael Vincent Garcia. Thanks for watching all the way from Canada. Mike, kumusta ka na? Anyway, so allow me to share my screen and then let's go from there. There. I hope you can see my screen, guys. And you know what? I suggest you position your phone or whatever is the tablet or phone landscape view instead of portrait view. Okay. Hinaan po natin yung ating bed music so that you can hear me well. Anyway, so we'll talk about DVT or deep vein thrombosis. So for those who are traveling right now and you've been driving or sitting for quite a while, usually more than 2 hours, please don't forget you pull over, step out from the car, move your extremities, walk, 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 walk in the light. No, not in the light. Walk, move around, make sure that your circulation is good. Because if not, if you're seated there for quite a while, you're facing your computer playing online games more than 2 hours, it's not a good thing. There's always risk for clot formation. Okay. So, what is DVT or deep vein thrombosis? Now, deep vein thrombosis refers to a clot, okay, a clot that forms, okay, where in the deep veins. Now, where are the common sites of your DVT? Or DVT can be found or can develop in your upper extremities, in your arms. Okay, a clot may develop in your lower extremities. A clot may develop in your abdomen. A clot may also develop in your lower pelvis. So, tandaan lang. So, DVT may namumuong clot sa ugat natin. Now, for you to better understand this, you need to go back to the scenario or the scene or the diagram in your cardiovascular circulation. Okay. Now you can see the heart on your screen on the left side, but I will use that later. Here, ito muna. Oh, what is this? Okay. Now this is our heart. See, ang laki niyan, ano? Now our heart is technically divided into two sides. So this is the right side of the heart and the left side of the heart. Okay. Now, when the heart pumps the blood out, okay, the heart. Remember, the primary function of the heart is to pump the blood out. So when the heart pumps the blood out, that blood enters a closed circuit. Okay, now that closed circuit is what we call a blood vessel. Now, a blood vessel connected on the left side of the heart. Remember, left side receives and pumps a blood that is richly, okay, oxygenated. It means a blood that has a lot of oxygen. Now it leaves the left side of the heart and it passes a blood vessel called an artery. A small artery is what we call arterial, okay? And then it passes your capillary, and that is where your gas exchange happens. Not only gas exchange, okay? There will also be, that is also the site where there's perfusion of gases, distribution of nutrients. Okay, why? Because it is in the capillary, the membrane is so thin, it's easy for those substances to pass through. That explains that when the blood enters the right side, the blood that enters here is a blood that is um, poorly oxygenated or a blood that has low oxygen. And the blood vessel here is what we call vein. Okay? So the vein technically is a blood vessel that carries blood back to the heart. Okay? So it carries blood back to the heart. An artery is a blood vessel that carries blood away from the heart. Okay? So just a simple, okay, just a simple, quick to remember: A, artery away from the heart; B, vein, back to the heart. I know the spelling of back is letter BACK, but just for a simple recall, V, back to the heart. Now, what happens in your DVT or deep vein thrombosis is that there is clot in your veins. So come to think of it, if a clot develops here in your veins, what will happen to venous blood flow? What will happen to the flow of blood back to the heart? Of course, there is obstruction. It impedes the normal venous flow. And that is where the problem, okay, in your DVT kicks in. So in your DVT, because of clot in the veins, it obstructs or impedes the normal venous flow. Okay. Another issue in your DVT is that, so just like this one, this is your vein in the lower extremity. There is a clot. There's a big clot. Okay, it's a big clot. It's a huge one. So because of this clot, the blood that travels from the lower extremities back to the heart is occluded. So as a result, it cannot go back to the heart, and it affects perfusion, it affects circulation. So in your DVT, it will not only affect circulation, it also affects perfusion. Another thing, come to think of it, when this thrombus dislodges, okay, when this thrombus dislodges, it gets out from the site, it enters the heart, okay, and you no longer you no longer call that thrombus. We now call that as your emboli. Okay, now this emboli or clot enters the heart, and from the heart it passes to your right atrium, right ventricle, enters your pulmonary trunk, enters your pulmonary artery. So it is where again it lodges, causing circulatory obstruction. So come to think of it, in your DVT, initially there's a clot in the lower extremities, and then this clot or thrombus, it dislodges itself from the endothelial lining of the blood vessel, endothelial lining of the vein. Okay, you no longer call it thrombus, you call it an emboli. So what is the difference between a thrombus and emboli? An emboli is a wandering clot. Okay, a thrombus is a clot that stays in one place. Okay, so if this clot or thrombus dislodges itself, you now call that as emboli. So an emboli is a wandering clot. So this wandering clot now can travel from one place to another, and sad to say, it enters the heart, and from the heart, it enters your lungs, causing obstruction in the normal flow, okay, in the pulmonary area. And that will result to a fatal, serious condition called pulmonary embolism. Okay. So from a simple clot, it causes obstruction in your lungs called pulmonary embolism. Okay. Now, I hope that one is clear. Now, in your examination, because you know how this thing works already, what is the scenario behind the DVT? In your examination, the common question here: identify the causes of DVT. How will you position your patient? What's your priority? Okay, so those are highlights in our topic today. Okay, by the way, thanks for watching. Who do we have here? Thanks for watching, Donna Kitan, Joshua Benadero. Hey, Josh, how are you? Eliza Servillon, Clyde Kirap, Dimple Jade, Lenny Kahilig. Thanks for watching. And Karen Atchakoso Batu. Thanks for watching. Now, way back, parang kilala talaga, ano? Long time ago, yeah, about 19th century, there is a physician. I think his name is Randolph or Rudolph. Please correct me. I think but I know his last name is Vir Virchow or Virchos. So there is a physician back in 19th century that was able to figure out the causes or factors that can result to a DVT development, okay, or DVT formation, and that is Dr. Virchow or Virchos. So that is why, because of his contribution, he named these factors as Virchos triad. So when I say Virchos triad, Virchos or Virchows, it's all up to you how you want to say it. Thanks for the heart.
Mike. So the virtuous or varicose triad, these are factors that will increase your likelihood to have DVT. So technically, these are causes of deep vein thrombosis. Okay, since we call it triad, so you can say that there are three common reasons or factors that can result to DVT formation. Okay, so let me identify these three factors and I will explain it one by one. Okay, number one, okay, the first factor under Vircho's triad that can lead to DVT formation is what we call venous stasis. Now, what is venous stasis? Other book, it's not venous stasis. They will call this or they will label this as impaired venous flow, okay, or impaired venous flow. Now, how can venous stasis or impaired venous flow result to DVT? Remember, I said that when the heart pumps, the blood enters the closed circuit. Okay, and that closed circuit is your blood vessel. Now, because of venous stasis, the blood flow is impaired for some reason. So that will result to platelet aggregation. Okay, the platelet will clump together. Okay, and then they will form a clot. The question is it normal somehow that there are small clot formation in the body? Yes, it is. There are times that the body will have small clots, but it can break away. Okay, it can break away. It cannot cause any issue. The problem is if it will not, okay, if it will not, it will continue to grow, causing circulatory occlusion, and that becomes a problem. Now, can you give me reasons or condition that can result to impaired venous flow or venous stasis? Okay, one good example here is immobility. Immobility. Now, what factors or conditions can result to immobility? Patients who are paralyzed, okay? Patients who had stroke, okay? Who because of this cerebrovascular accident, it resulted to motor deficit, so patient can no longer walk. Okay, so that will make the patient bedridden or bedbound. Okay, what else? Sitting for a long period of time with your legs crossed, facing your computer, sitting for a long period of time, playing online games with your legs crossed, or sitting for a long period of time. Okay. Another condition that can cause venous stasis is what? Patients okay, with fracture and their intruction. So if you are intruction, of course, you don't walk. Okay. So that can result to venous stasis. That's number one, immobility. Okay. So what is the implication here as nurses? Implication here, you promote passive range of movement. Now, how is movement? How is passive range of movement? How is active range of movement? How is walking helpful? How are those conditions or activities help prevent DVT? Now, what makes it different from your artery is that the blood flow in your artery is high pressure and related to pumping mechanism of the heart. Okay? So remember I said that the artery carries blood away from the heart. It is facilitated by pumping mechanism. But the vein, it's different. Okay? Because here the blood flow is back to the heart. So who will pump the blood inside the vein? Okay, who will push the blood from the vein back to the heart? It's about the skeletal muscles. So come to think of it, if this is your vein, and it's surrounded by your skeletal muscles. When you move, okay, when you move, regardless whether it's a passive movement or an okay, active movement, when your muscles contract, they will squeeze the blood vessels inside, and those squeezing of the veins will propel the blood back to the heart. So analyze if you don't move, the muscles will not contract. Okay, so failure of the muscles to contract will affect blood flow. Okay, so part of your responsibility as a nurse is to promote range of movement. This will promote circulation. This will enhance perfusion. This will prevent clot formation. Okay, so that is why if you are the nurse and if you have free time, you can go to your patients who is immobile or paralyzed or had stroke and cannot move one body part. Try to move that. Sometimes we work with a PT or sometimes we work with OT. And sometimes we recommend and advise family members to do, try to move your relatives' extremities, flex, extend. You know what I mean? Okay. So when muscles contract again, it helps propel blood back to the heart. So that's number one, immobility. Okay. The second factor in your virtuous triad is hypercoagulability.
or shall I say hypercoagulation. Now, what do you mean by this? It means to say, when you say hypercoagulation, is increased likelihood of clot formation. So, increase, what is FLO? What is that? What am I writing? So, increase in your clot formation. Now, give me a condition or factors that can result to increased clot formation. Now, one good example here is dehydration. So please don't forget, drink a lot of water. Drinking water will help what? Dilute the blood. If the blood is concentrated, if you are dehydrated, if the blood is concentrated, the blood flow is viscous, the blood flow is not good, and that will promote clot formation. Okay. Another condition that can result to hypercoagulation or increase clot formation, of course, an elevated platelet count. Okay. What is the medical term if you have increased platelet count? You call that condition as your what? Thrombocytosis. Okay. Now, if there's too much platelet, remember platelets, you know the reason. Okay. They will prevent bleeding. So if there's too much platelet, then it promotes clot formation more than the normal. Okay. Another condition that can result to hypercoagulation is an increase in the RBC, an increase in your WBC, and an increase in your platelet count. Again, increased platelet. Now, what condition is this? What is this blood disorder or blood condition that is characterized by an increase in the RBC count, WBC count, and platelet count? In short, increase in the formed elements. Now, you call this type of blood disorder as your polycythemia vera. Okay, so if you are the patient, okay, with polycythemia vera, drink a lot of water. Okay, drink a lot of water. Avoid going to high altitude places, because going to high altitude places will promote more blood formation, and that will further increase your blood concentration, leading to clot formation, increasing your likelihood to have, okay, clot formation. Okay, yeah, that's what I said. Now, another condition that can lead to hypercoagulation is what else? Pregnancy. Do you know that if you're pregnant, there is increased clot formation? That is why it's not advisable to massage the lower extremities of pregnant mom because of clot. Remember, what is the implication if you massage the side? Now, I hope you can remember the difference between thrombus and a clot, thrombus and an emboli. Okay, so if you massage the side, the thrombus, now you dislodges the thrombus. Now it becomes an emboli, a wandering clot. So it's not advisable. Now, another condition can result to hypercoagulation is patient taking contraceptives. And this is a common question in your exam. Contraceptives. But again, not all contraceptives. Okay. Now, the specific contraceptive you need to remember in your exam is a contraceptive that contains estrogen. Okay. Why? Estrogen increases clot formation. Okay. Now, these are just common conditions that can result to increased clot formation. Now, what else? Number three, under Virchow's triad, number three, the third factor that can result to increased clot formation is blood vessel injury. Number three, blood vessel wall injury. Now, or some book, I think they will write their endothelial injury. So technically, there's injury in the blood vessel of your patient. Now, haven't you asked yourself, in the blood, you have your platelet, okay, you have your RBC and WBC. Why is it that your platelet will not adhere in the walls of your blood vessel? Because in the walls of the blood vessel, there is a protection preventing the platelet will adhere to that, causing clot formation. But because of an injury, okay, there is likelihood that a platelet would adhere in the wall of the blood vessel, causing clot aggregation. Now, can you give me an example of a blood vessel injury that can lead to increased clot formation? One good example is a patient who had surgery, okay, or patient who had burn injury. Remember, burns can cause blood vessel injury, okay? And what else? Patient with sepsis, okay? Patient with sepsis will also have blood vessel injury. And guess what? Patient with sepsis can also have hypercoagulation. So you can also include that here. Okay, that explains, by the way, that explains why that patient with sepsis has a higher
a chance of developing DIC or disseminated intravascular coagulation. Anyway, that is a separate topic. So these are three common factors that can result to DVT formation. Again, you call this a Severe-Child's triad. Now, in your examination, sometimes you'll be asked to identify or select all the replies that can result to DVT. And please do not forget this three. Okay, you call this a Severe-Child's or Virchow's triad. Now, let's proceed. Now, what are common presentations of your patient? Okay. Now, what are common presentations of patient with DVT? Let's write it down. DVT. Signs and symptoms. Number one. Now, when the patient walks, okay, remember that because of circulatory obstruction, when the patient walks, okay, there is pain when the patient walks. And when the patient is at rest, the pain disappears. Now, what do you call that condition? Okay. What do you call that condition wherein the pain is aggravated by walking and the pain disappears when the patient is at rest? You call that as your intermittent claudication. Intermittent claudication. Don't forget that. Okay. Number two, a patient with DVT will have edema or swelling. So you will know that one extremity is appear bigger than the other one. So you will suspect DVT. Number three, there is pain, of course. Okay. Number four, okay, the skin of the patient is warm to touch. The skin of the patient is warm. Don't forget this. Warm to touch, okay, for occlusion or obstruction in the vein. But if the occlusion or obstruction happens in the arterial line, in the artery, remember, artery carries blood away from the heart. Vein carries blood back to the heart. If the occlusion happens in the arterial line, mostly the case skin of the patient is cold to touch. So cold to touch for arterial occlusion. But for venous occlusion, usually it's warm skin to touch. Next, number five. Okay. Now, because of occlusion, remember it affects blood flow back to the heart. So the blood congests in the lower extremities or distalted occlusion. Okay. Not just in the lower extremities, but also that depends where the DVT is. But nevertheless, there is occlusion resulting to backup of blood. So because it affects the normal blood flow. So as blood congests distalted occlusion, that will result to distended superficial veins. Distended superficial veins. Okay. And number six, don't forget this. There is a sign that will be present if you have DVT. Now, what do you call that sign when you dorsiflex the foot of your patient and there is pain? Of course, if the DVT is in the lower extremity. Now, you call that sign as your Hohmann's sign. So you will have a positive Hohmann sign. But take note, just a heads up, not all patients with DVT will have positive Hohmann sign. Okay, your Hohmann sign is only present if if the clot is really huge, but if you have a small clot, you won't have a positive Hohmann sign. Okay, so technically these are common presentations of your patient. Okay. Oh, by the way, before I forget, please, just a heads up, these pictures are not mine. Okay, I just took this in the internet, so I don't want to have issue with the copyright. Okay, so how do we diagnose, or how do doctors diagnose DVT? Now, what are common diagnostic tests? Oh, by the way, before I proceed with the diagnostic test, another question in your NCLEX here is the most appropriate nursing diagnosis. What is the most appropriate nursing diagnosis of your patient with DVT? Remember, in DVT, there is circulatory occlusion. There's circulatory obstruction. The answer in your NCLEX will be altered tissue perfusion. Don't forget that. This is the most appropriate nursing diagnosis. Now let's proceed. Diagnostic test. Diagnostic test. Now, how do doctors diagnose DVT? They will diagnose DVT based on the patient's presentation, like patient signs and symptoms. Okay. Now, apart from that, doctors would do your D-dimers test. D-dimer test. Now, what is D-dimer or D-dimers test? D-dimers test is a type of a blood test that will check levels of D-dimer. Now, what is D-dimer? A D-dimer is
A protein is a fragmented protein, uh, as that is actually a byproduct of clot, or that results from clot that has been broken down. Okay, so that is your D dimer. Now, the higher the D dimer level means the higher chance of DVT. Okay, now what is the normal D dimer level? The normal D dimer is less than 500. Okay, less than 500. I think it's nanogram per ml, but I know it's less than 500. But again, if the D-dimer level is more than 500 nanogram per ml, then there is a higher chance of DVT. Okay, or not only DVT, there's a higher chance of stroke, higher chance of pulmonary embolism, higher chance of DIC. Okay, but take note, there are also conditions that will cause elevation of DVT, elevation of the dimer, just like pregnancy, surgery, or even some types of cancer, okay, can cause elevation of your D dimer. Okay. Now, what else? Another diagnostic test will be your, of course, your CT scan. Okay. Number three, another is your angiogram, your angiography. So if you've been following me, I mentioned CT scan in my previous videos and my previous videos as well. I mentioned angiogram or your angiography. Okay, so these are common tests. Now, what are common treatments here? The common treatment, of course, we give medicine to patient. Now, what are common meds? Doctors may prescribe antiplatelet. Doctors may prescribe anticoagulant. I will no longer discuss this. I've been doing this discussion several times. So just check my previous videos. Antiplatelet, anticoagulants, doctors may prescribe thrombolytics. Okay, so what's the difference? An antiplatelet, just like your aspirin, an antiplatelet is an agent that prevents platelet to form a clot. An anticoagulant is an agent just like your heparin, just like your enoxaparin or Lovenox, just like your warfarin, Coumadin. These agents will prevent clot formation. Your thrombolytics, we call this as your clot busters. These are agents that's like your TPA. Our TPA stands for tissue plasminogen activator. This is an agent that dissolves the clot. Okay, so technically they will do something about clot. Okay, now what else? Procedure, yes, doctors may remove the clot. You call that your thrombectomy, thrombolectomy, or thrombectomy, or embolectomy. Okay. Now, highlight in your exam. If your patient, okay, if your patient is DVT, okay, the question here, can we massage the site? No. Okay. Now, what are ways to prevent DVT? Ways to prevent DVT, you wear your SCD stockings, your sequential compression stocking or sequential compression device. But if you have positive, if you're diagnosed with DVT, we don't use those. Okay. But for preventive, it means to say you don't have DVT yet. For preventive measures, we wear, or not you wear, we recommend the patient to wear the anti-emboli stocking. Now, for anti-emboli stocking, just write it down. Preventive measures. Okay, number one is hydration. Number two, positioning. How will you position the patient to prevent DVT? You need to elevate, okay, the extremity, affected extremity that's prone for clot formation. Why will you elevate? You need to elevate to promote venous return. Okay. Next, number three. What else? You need to promote circulation and promote perfusion. How will you promote circulation and enhance perfusion? Range of movement. Okay. Now, if your patient can walk, of course, we encourage the patient to do active range of movement. If not, we do passive range of movement. If not, if the patient cannot stand and walk, but the patient can move his or her extremities, We do encourage what? We do encourage isometric movement. Now, what is isometric movement? What is the difference between an isotonic movement and isometric movement? So please don't confuse yourself with isotonic solution, hypertonic solution. Those are the different solutions based on its tonicity. So here it's not, we're not talking about the solutions, okay? We're talking about types of movement. Isometric movement and isotonic movement. When you say isotonic movement, okay, there is contraction and there is flexion. Okay, that's your isotonic movement. Let me give you an example. So if I'm going to flex my arm, okay, flex my right arm, so there is contraction of muscles, so there's successful sliding filament movement, and there's also flexion. Okay, so you call this as your isotonic movement. When I say isometric movement, okay, isometric, there is muscle contraction, but there is no flexion. Let me give you an example. Okay, here. I will push this door. If I will push this door, okay, as I push this door, my muscles in this arm contract, but there is no flexion. Okay, so muscles contract, but there is no flexion. You call this type of movement as isometric. The question here is, how will you instruct isometric movement to your patient? For example, your patient has a cast, your patient has a traction applied. How will you promote isometric movement? Very simple. Tell your patient, can you push your heel against the mattress? So if this is the heel of your patient, tell your patient, push your heel against the mattress. Pushing your heel against the mattress, okay, will promote contraction of the muscles in the lower extremities, but without flexion. Remember, what did I tell you a while ago? When the muscles contract, they will squeeze the blood vessels and will propel the blood back to the heart. See? So even without flexion, as long as there is muscle contraction, it helps circulation. It helps venous return. Okay? Now, what else? Preventive measures number 4. Okay, let the patient wear an anti-emboli stocking or an anti-emboli device. Okay, one good example is your anti-emboli stocking, a device just like your SCD, a sequential compression device. Now, I want to stress the anti-emboli stocking because this is another question in your exam. When is the best time to wear an anti-emboli stocking? The answer is early in the morning before arising from bed. Okay, it means to say in the morning as soon as you open your eyes. Okay, you get the anti-emboli stocking, put it on before you stand. Because if you, the moment you stand, okay, without wearing the anti-emboli stocking, you had given the chance, okay, you had given the blood a chance to pull in the lower extremities, and that will promote clot. So you don't want that thing to happen. So that is why before you stand, you put the stockings on. Okay. So again, the anti-emboli stocking must be worn in the morning before arising from bed. Don't forget that. Okay. And what else? Other preventive measures. I told you about hydration. I think that's all. I hope you learned something, guys. Okay. Anyway, thanks for watching to Nami Makapas, John Mark Berwin Segudo, RZL Day, Janine Carla. Thanks for watching. Okay, I think that's all for today, nurses. I hope you learned something. God bless. Okay. And I hope to see you soon in the next vlog, shall I say. Okay.